This will be a blitzkrieg of the new Obamacare healthcare reform law. On the first line, you'll see the three major insurance benefits that will be kicked into law in 2014 are no pre-existing, no more lifetime limits, and no more cancellations. If you're now covered under a group like most people are, nothing will change. If you're an individual or a worker at a small business, you'll have some new resources in the form of a high-risk pool in 90 days, state-operated exchange marketplaces in 2014, and middle-class subsidies. Medicaid will be expanded to include people within 133% of the federal poverty level, which is currently $22,000 a year. Medicare will be reformed and strengthened by elimination of the donut hole over time under prescription drug coverage. The Advantage plan, which is now an HMO, will be converted to traditional Medicare, and there'll be a huge effort to reduce and eliminate fraud and abuse. If you're a small business owner and you have more than 50 employees, you'll be required to either cover them or pay a fine per employee, and the state-operated exchange is a new marketplace which start up in 2014, will be on a state basis, one per state, and have several competitive structures. The penalties, when it's all said and done, for not buying insurance will be about $1,000 a year for a person, $2,000 a year for a family, and about $2,000 a year per employee. Immediately in year 2010, we have some credits to small business. In 90 days, the high-risk pool for those who are pre-existing conditioned and uninsured, and some help for the people aged 55 to 65 in the form of reinsurance. In 6 months, or about the 1st of October, rescissions are prohibited. Dependents are then covered from age 23 up to 26, 3 more years, and the big concept under Obamacare of wellness kicks in with $1 preventive services coverage. All insurance companies will have to reimburse you for childhood immunizations, cancer screenings, and the like. And finally, no pre-existing starts up early on children aged 19 and younger. Between 2012 and 14, you'll see on the middle bullet that the affluent, who are defined as people making more than $250,000 a year in adjusted gross income, will begin paying, quote, their fair share in the form of a higher Medicare tax rate and a new unearned investment income tax of 3.8%. The key date is January the 1st, 2014, when the mandates kick in and you have to pay a fine or show evidence of insurance. Medicaid will then be eligible to the 133% of FPL, and the state-based exchanges start their operation. Some of the other known provisions in the middle, you'll see rating only by age, region, or tobacco. This is revolutionary because there's been dozens of rating criteria before. Government can block rate hikes. The Secretary of HHS has broad new powers and can force rebates and deny rate increases if deemed unreasonable. The middle class subsidy is in the form of a sliding scale tax credit up to 4 times the federal poverty level, which you calculate out as $88,200 a year. If you are eligible for a state exchange and you don't like your choices, you will have access to the national insurance plans through the OPM, or Office of Personnel Management. There's no coverage for abortion control under Obamacare. Here are the funding sources in descending importance and order. A lot of savings through prevention and wellness, and the old adage that an ounce of prevention is worth a pound of cure. A little more money up front will save tons of money on the back end by eliminating many of the chronic illnesses. Taxes on the affluent, reduction in the Medicare fraud and abuse, new fees on the pharmaceutical industry, and taxes on the insurance industry. The next two, the student loan program and the small long-term care insurance plan, they were put in here to help reduce the cost of the bill, and the revenues come off the long-term care and the savings in the student loan program, which was going to be done anyway, being put directly under the Department of Education. And finally, the fines and penalties will also sweeten the pot. This is an insurance slide showing the fallacy of cost savings. First of all, the experts in the field say the 3 things that was wrong with health care that needed correcting were cost, access, and quality. Now, access is taken care of in 2014 with some question about affordability. Quality depends on who you are. If you were a union member with a so-called Cadillac health plan, your quality is going to dip a bit. But if you were uninsured and have insurance for the first time, well, you'll have full quality. The real problem is cost. It has not been taken care of with Obamacare and remains something to be solved in the future. By that we mean the charges that are made at the provider level through your physician, your hospital, or your outpatient clinic. They're still unchecked. And what we're going to have to do is address it in the future. Also, the reason the cost savings are not what are shown, Medicaid expansion is unfunded and 50% on the states. New insureds are less healthy. We call that adverse selection in the insurance business, meaning the 32 million that are uninsured now are a little less healthy as a profile than 32 million out of the general population. It costs more to increase the benefits like prevention. Elimination of the lifetime limit means very expensive claims like a serious cancer claim are unended and ad infinitum. The unisex rating, which is new, it's going to be more costly for men because women always were rated higher and now it has to be one rate. Mandates, things like raising the dependent age to 26 cost more, and the estimates that they made for Medicare savings were unrealistic, having double counted one particular calculation. Here is the name of the act, the Patient Protection and Affordable Care Act, and it does indeed expand the Medicaid program for the poor, establish a subsidized marketplace for middle-income people and small businesses, that is, businesses with more than less than 50 employees, and it puts the mandate on people starting in 2014. What happens when? Right away we get the small business tax credits in 90 days, or about July 1st, the high-risk pool. In 6 months, or about October 1st, the no pre-existing on children 19 and younger, the federal oversight, and dependent care up to age 26. You'll see that in 2011 there's bonuses to Medicare physicians that will relocate into needed areas, and the long-term care program starts up with class. FSA means flexible spending accounts. Those are the HSA type limits. They're going to be mandated at $2,500 in 2011. The key year in red, 2014, the mandates to either cover yourself or pay a fine starts. The 3 benefits kick in, an asterisk, and then the insurance exchanges start their operation. In the final implementation year of 2018, there is a 40% excise tax imposed on the so-called Cadillac plans to discourage their use. I'm on the right. My name is Clint Day, and I'm a chartered insurance underwriter, and Jeff Sadler, my partner's in the middle. We formed health reform counselors to help people with these massive changes. The bill is over 2,500 pages long, and we'd be happy to help you for a modest fee for profit corporations, free for nonprofits, and we'll answer your questions by email if you'll contact us, clint.day@comcast.net or jeff@tristatedi.com. Also, our cell numbers, Clint's 770-262-1023 and Jeff 813-774-0667. We're based out of the Southeast in Atlanta and Tampa.